So today we'll continue with the chapter 24, page number 265, gut microbiome, probiotics, prebiotics, and postbiotics. I'll take only one chapter today since we have only very few participants today. So if anyone is joining late, please help them out with the page number or topic name. So gut microbiome or biota microbiome or gut flora are all microorganisms, including bacteria, archaeas, fungi, viruses that live in your digestive tract of animals. And when it comes to human, majority of the microbiome of in human body is found in gut. Okay, gut is the main location of the human microbiome. So microbiome means what? It's an aggregate. It's not just bacteria, but also the genomes of the gut microbiome, because it will not change. Okay, once you have developed a gut microbiome, soon after the childbirth, okay, when the child starts to have the first feed, first breast milk, during the birth, whatever microbiomes the child has ingested, okay, based on that lifetime, the child's gut microbiome will not change. It will remain pretty much the same. Okay, so it's the genetics, the genome, along with the all the microflora, both of them together is what we call as the gut microbiome. The gastrointestinal ecosystem and the gut microbiome. At birth, as soon as a child is born, the GI tract of the newborn baby is considered sterile. Okay, within hours, the bacteria that the child has ingested during the birth canal, during birthing, that is specifically natural birth, vaginal birth. In C-section, doesn't happen, but when the child undergoes natural vaginal birth, the child ingests certain flora which is present in the mother's vaginal canal as well. Okay, so these flora will immediately it will colonize the entire gut. Okay, and within few days, the gut, the just a GI tract of the child has 10 times more bacteria as compared to the entire body cells. Okay, whatever cells the child has on its body, newborn baby, more than those cells, 10 times more than those cells, the microbiome is found in the baby's stomach, in the gut and that GI tract. So this microflora is responsible for priming your immune system in your gastrointestinal tract. Okay, this will ready your immune system. Okay, in what way? The gut microbiome, the body will understand, will learn, adapt that this flora, this microbiome present in the GI tract is not harmful. You are not supposed to attack it. Let it be. Okay, this is how you have to the microbiome will prime your immune system as soon as the baby is born. Okay, the immune system will learn that this is good bacteria. Okay, it will identify the good bacteria out of the bad bacteria. This is the priming of the immune system that takes place. So after this initial colonization, the person's individual gut flora remains remarkably constant throughout the entire life. Okay, so the immune system will also learn to recognize and tolerate these bacteria which you have acquired during infancy, and it is with very difficulty this flora will change ever. Okay, if at all the flora changes, it will affect your immune system as well. You will fall sick, you will have a lot of GI trouble. Okay, it means the flora is changing. So they also provide a natural barrier against other infective bacteria that you uh, tend to adapt during the other phases of life. So that's about your gut microbiome, intestinal ecosystem, how it develops from infancy to the entire life. It will not change usually, if at all. In C-section, the child does not have a chance to ingest the vaginal flora. Okay, because in C-section, the child is taken directly out of the sterile environment of the uterus. The child hardly what the child must have ingested would be the mother's amniotic fluid, not more than that. Okay. Probiotics. So probiotics are live microorganisms that can have beneficial effects inside your body. Some probiotics are available which you can apply on top of your body as well in some cosmetics, skincare. Okay, but usually majority of the probiotics available are the ones that you can eat. Okay, so ingest. Every human body is home to trillions of microorganisms that live within us and help support our bodily functions and health. But beneficial microbes like probiotics help to control the potentially harmful types. So this probiotic products contain specifically select variant of microbes which we know already are beneficial. Okay, when they increase, they multiply in your stomach, it will bring more health benefits than put you in at any risk. So these microbes, to add to the population of already living bacteria in your body, it will be more helpful for you. Okay, it has more health benefits. So many probiotics are oral supplements designed to be ingested directly into your gastrointestinal tract. Some probiotics are topical applications which comes in cosmetic formulations. Okay, so these are the probiotic rich food which can help in digestion and gut health. Yogurt, kefir, buttermilk, aged cheese, that is fermented old cheese. Okay, sauerkraut, kimchi, miso, tempeh. Okay, tempeh is also available in Indian market these days. Brined pickles, kombucha, fermented veggies, natto, sourdough, raw milk and cheese, lassi, apple cider vinegar with the mother. Okay, so these all are considered as fermented. These food have undergone fermentation. One thing common among all these food is they have undergone fermentation, so they naturally have the microbiomes, that live microbiomes that can go and support the gut health. So prebiotic is a selectively fermented ingredient that allows specific changes both in the composition or the activity of your GI tract. So microflora that confers benefits upon host well-being and health. So prebiotic is something that you give, you take, you ingest to help the already existing microflora in your body to multiply. Okay, it's like the food that you give to the microbiome you have in your gut. And whereas synergized combination of probiotics and prebiotics are called symbiotics. So if there are certain foods that are a combination of probiotic and prebiotic, so that's what we call as symbiotic. So prebiotic is the food that you give for so that your microflora within your gut can multiply, they can thrive. Okay, that is prebiotic. Probiotic are you are directly having live microbiome. Okay, ingesting live microbiome. Symbiotic is the combination of both probiotic and prebiotic. So live bacteria is what we call as probiotic. Food for bacteria is prebiotic. So combination of both pro and prebiotic is called symbiotic. What is postbiotics? Postbiotics are metabolites or byproducts, okay, after your probiotics have reacted with the food, okay, or the postbiotics release certain enzymes, they release certain factors into the gut. Those are called postbiotics. Okay, so it is they're either microorganisms themselves or their components, what they release into your gut ecosystem. Okay, because every living organism will release something. Okay, for survival it has to take something in and it has to release something out. So whatever metabolites, the something like antibodies or some metabolites, some soluble factors, enzymes, okay, byproducts, some acids, peptides. Okay, these are the These are the factors that the bacteria can release within your microbiome, and it is very helpful for the host health. Okay, these factors that are released by the bacteria, these are called postbiotics, because they come from the bacteria, and they improve the host health along with prebiotics, postbiotics together. They will improve the host health. Then we have a situation called dysbiosis. Dys means something altered. Biosis is the system of your microbiome. Okay, the microflora that is present in your gut. So any alteration, okay, that could lead to either too much of flora in your gut or too little of them. Both are both will lead you to some ill effects on health. Okay, either having too much of gut bacteria, sometimes your own gut bacteria can infect you. Okay, if it goes above and beyond the normal threshold, it can infect you. Okay, if it goes below than the appropriate levels, it can lead to gastrointestinal issues. Okay, so reduction it happens in stages. Okay, in stage one, small reduction of normal anaerobic microflora will take place. In second stage, more decrease in the normal anaerobic bacteria will take place, and pathogenic microbiomes will come and replace them. Okay, slowly there will be significant decrease in the good bacteria, and actively all the pathogenic bacteria will reproduce. Okay, and they will take place of the microflora good bacteria. Okay, so this happens in stages. So this is what we call as dysbiosis. Application of probiotics. Probiotics in health and well-being depends on complex and dynamic interplay between the factors that control vital processes such as appetite, energy balance, metabolic rate, stress response. Okay, so eating habits are responsible for each and everyone's overall health status. Probiotic in your food is something that everyone overlooks. Okay, very few people are concerned about it, and in all the traditional food you will always find that fermented food was always used. Okay, fermentation is a method used to preserve food, and this helped in the health of the gut microflora as well. So ingestion of any fermented food will expose the host to prebiotic organisms. Okay, and in Western diet usually there is no fermented foods used much. Okay, so that's the reason why people who follow a very Western kind of lifestyle or a Western diet, they will usually suffer a lot of gut issues, colon cancer issues, colon health issues. It's very common among Western people. And probiotics and intestinal disease. So probiotics and prebiotics are considered as the most health promoting organisms. And if you do not have enough amount of them, there are many studies that they have proven that to prevent GI disorders, specifically diarrhea in children, okay, antibiotic associated diarrhea, Clostridium difficile associated diarrhea, in all these situations, if you use probiotics, it can give you it can release you from the symptoms as well. Okay, so that is the importance of probiotics. Then infectious diarrhea and probiotics. It has been using probiotics has been shown as a successful method of treatment to prevent various types of diarrhea, like even rotavirus. Okay, Clostridium difficile and traveler's diarrhea. Even in these kind of situations, probiotics have helped. Various studies they have mentioned in the textbook, in which how the results have been, that also they have given in statement form. So it proves that in infectious diarrhea caused by any bacterial or viral or fungal infection, probiotics can help in eradicating the symptoms. Clostridium difficile diarrhea. Clostridium difficile is the name of the organism that causes diarrhea. So it is an infection. It's symptomatic as well, and it disrupts the endogenous flora, and it will suppress the growth of the seed difficile. So under normal conditions, so although the infection is with C. difficile, this Clostridium difficile, it usually responds well to the treatment with oral antibiotics like metronidazole, vancomycin. Okay, and metronidazole, vancomycin are the class 2 antibiotics. Then traveler's disease, sorry, traveler's diarrhea. Probiotics have seemed to prevent viral induced diarrhea as well, better than bacterial diarrhea. Inflammatory bowel disease, IBS. Escherichia coli. Okay, that is the probiotic consisting of non-pathogenic E. coli, Escherichia coli, or you call it as E. coli. So, so probiotics that contain these E. coli bacteria can be used to treat inflammatory bowel disorder. Lactobacilli can also be used here. Streptococcus, one strain of streptococcus can also be used in to maintain the remission in patients who have IBS or ulcerative colitis disease as well. Even in Crohn's disease, oral therapy using lactobacilli has shown improvement. Then we have H. pylori, that is Helicobacter pylori. So Helicobacter pylori is not known to cause peptic ulcer. Too much of Helicobacter pylori can cause peptic ulcer. So whatever probiotic foods that you eat, that can act as an antagonist to Helicobacter pylori, which means if you have probiotics in your stomach, Helicobacter pylori will not grow, and thus you will not suffer from peptic ulcers. Then allergy and probiotics. So there has been an ability of probiotics which was seen in reducing the symptoms of atopic dermatitis, and randomized controlled trial kind of a study was conducted among breastfed children who had eczema. That means you suffer from dermatitis. Eczema is like redness and itching on the skin, kind of a dermatitis. It showed that the group of children who received probiotic supplement, they had significant resolution of their symptoms as compared to the group that didn't receive probiotics. Okay, so there is some relation between probiotics and allergy. Immune regulation and probiotics. It was seen that some probiotics, they can be capable of both uh, regulating the allergic response and also in enhancing the immune response against pathogens. So regularly taking probiotic food can strengthen your immunity as well. Specifically lactobacilli, it can enhance your antibody response in adults, and also in preventing respiratory infection. This study was done by a study in Finland. Coming to probiotics in critical care, so the incidence of multi-organ failure in ICU is quite high, and infection is a important causative cause that leads to this multi-organ failure. So patients who are often treated with broad-spectrum antibiotics to help cure them out of infection. What these high dose antibiotics will do is they will also eliminate your good microbiome. They also have the potential to eliminate your good microbiome. Okay, so when prebiotic or postbiotics were introduced into the critical care diet, okay, it had shown a better response. Patients had shown a better response in getting back to normal. So patients who get more susceptible to infection because of the microbiological translocation, okay, for them using probiotics and prebiotics gives them a better uh, reason to get they can cope easily and they can come back to health quickly. Side effects, uh, usually we haven't seen much side effects or major side effects with the usage of probiotics. Some sort of fungemia, which is presence of fungus in the blood, has been seen in the administration of S. boulardii, okay, in an immunosuppressed host. But then it was treated successfully with antifungal therapy. That was the only known side effect. But the host was immunosuppressed, means that in the host, the immunity was quite down. The patient was kept on immunosuppressants most probably. And when the patient was given probiotics, it could have led to overgrowth of fungi into the bloodstream as well. But with antifungal therapy, the patient came back to normal. So we do not have major side effects of using probiotics by large. So that's about the small chapter of probiotics, prebiotics. If you